So, hi everyone. This is our value proposition. We're creating a polymeric heart valve replacement for TAVR procedures. My name is Jan.
I'm Mattea.
I'm Chyla.
I'm Michele.
Here we go.
So roughly 300,000 Americans per year suffer from aortic stenosis, which is a disease resulting from calcification of the aortic valve. To treat this disease, patients can receive either a mechanical or a bioprosthetic valve, and to receive either of these valves, patients undergo open heart surgery, but high-risk patients must seek an alternative approach. So transcatheter aortic heart valve replacement, or TAVR, is a novel minimally invasive alternative. TAVR valves currently on the market are bioprosthetic in that their leaflets are made from biological tissue, and these leaflets tend to be thinner than leaflets of valves used in open heart surgery, which subjects them to higher stresses and calcification. And so there's a need for a TAVR compatible valve that reduces the risk of calcification, preserves the durability of mechanical valves, and also eliminates the risk of blood clotting. So specifically, we're targeting aortic valve disease patients who are at high risk of complications during surgery by eliminating the need for open heart surgery and decreasing the chance of valve replacement failure, which will eliminate the need for a second surgery.
As a response to the clinical need, our team has decided to design a heart valve replacement that is more biocompatible and can withstand the biomechanical environment it is placed in, so patients of all ages and levels of risk can benefit. We plan to combine the favorable mechanical properties seen in current mechanical valves and the anti-thrombotic effects seen in bioprosthetic valves through designing a polymer-based heart valve for the TAVR procedure. In order to do so, we considered several engineering and design criteria, including the hemodynamics of the cardiac cycle, the shear and bending stresses encountered by the valve, and the surface properties of the surrounding tissue. With these criteria in mind, we aim to create a 3-leaflet heart valve made from the polyolefin thermoset elastomer excids, as it has been seen to have favorable biomechanical properties. The leaflet walls of the valve will be made using thin film fabrication to reduce stiffness and risk of failure due to high bending stresses. This material will surround a nitinol mesh that will help maintain the strength and shape of the leaflet, as well as increase the durability of the device. The leaflets will be convex and angled in the direction of the blood flow to help minimize shear stress and the effects of blood pressure during the cardiac cycle. To help address the issue of thrombosis, the polymer will be coated with anticoagulants, such as heparin, through ionic attachment, ultimately changing the surface properties of the device to be more biocompatible and hemocompatible.
So here are our values for our benefits and costs for the design for a safe and effective polymeric replacement. In terms of cost, the procedure for implantation is about $32,000, while producing nitinol would approximate to $11 per pound. Using an XSIBS device with heparin coating would get rid of the need for patients to take anticoagulant medications after surgery, which is typical for standard TAVRs. Also, it would have an increased durability to over 200 million cycles while remaining non-toxic in the body. The regurgitant fraction is reduced to less than 25%, whereas standard mechanical TAVRs have fractions of 30 to 50%. And the pressure gradient is found to be lower than 20 millimeters of mercury to reduce stenosis or other forms of aortic insufficiencies.
So, just a little bit about our competition. There are many companies which produce aortic heart valves, and most of which provide the option between mechanical, bioprosthetic, or TAVR valves. Current mechanical valve options are made of carbon or titanium, and they have a lifespan of about 25 years or so. However, they do require the use of anticoagulants for usually the rest of the user's life, just because blood tends to clot on the surface of the mechanical valves. Bioprosthetic valves do not cause blood clotting, and they're made of bovine pericardium tissue. However, these valves only last about 15 years or less, and they tend to calcify. TAVR valves are very similar to bioprosthetic valves. However, they're more for patients at high risk for at open heart surgery. And so the team plans to combine all of these products into one super product that we can market to our primary audience, which would be the leading companies in producing heart valves, such as Edwards Life Sciences, Boston Scientific, and so on. And then hopefully after marketing to them, we can make it easier for our patients to access this product and and, fix their heart valves.
Thank you. Any questions?